And into the parts of the protocol, we have talked about the introduction, talked about the abstract, talked about the objectives, and also the background and rationale. And a little bit we talked about the eligibility criteria. Is it correct? We stopped at eligibility criteria.
Yes, sir.
Okay, I think this slides we have seen. So we have inclusion and exclusion criteria, where we have all kind of I explained like how an inclusion and exclusion criteria can be done. And usually the eligibility criteria should be kept to a minimum, should not be included too many, because it also causes the lot of confusion in many things. But whichever it is applicable, you should never miss. But as much as possible, you have to keep the minimum, because if you keep it too much, and this one, and doing a clinical trial will become a very difficult. And also the criteria should include only necessary scientific validity and patient safety. And the criteria also should be clearly defined and verifiable. So you can see the screen now.
Yes, sir.
Okay. So more verifiable for the external editor, they should be able to understand the criteria, the eligibility criteria. So the next one is the study design. This is also a very important thing, because when they usually check any protocol, they see the research question, the rationality, the objectives, and the study design, whether an appropriate design is used in the study or what. Because there are n number of different designs, and each designs have their own advantage and disadvantage. So one for particular study, there is no such okay, some designs like randomized control studies, no, it will give a very good results. But it's not that the designs one is so much superior and others are this. So based on the study type, whatever it is, an appropriate design has to be used for that. Even if you say like randomized control study is an superior design, but the type of study you are doing is not, this randomized control trial cannot be incorporated in the study, means you cannot do it. Okay, so based on how I was talking, today my internet connection is very slow, I feel. So that's how we have to go about the uh, the involving the study design. So they should contain a stepwise description for all procedures required for the study. So many times the study design should include an appropriate thing, as I told, like initial evaluation. So initial evaluations in sense like before starting the study, so what are the initial testing has to be, and also the screening test before because screening test and initial evaluations is very much required for assessing the eligibility criteria, whether it comes under inclusive or exclusive criteria. If I say like The liver enzymes above 5 times the upper normal limit is an exclusive criteria. Then, okay, in the screening test, you have to do the liver enzymes and check what is the value. So if it is coming upward more than upper 5 times the upper normal limit, then you should exclude it. So this usually helps in like uh, uh, classifying the whether it comes into inclusive or exclusive criteria, and required lab test and any kind of treatment details and supplementary procedures. Treatment and the supplementary procedures, mainly if the patient is taking some drugs and also undergoing some other treatment, like if they like doing like any kind of the meditation, yoga, physiotherapy, so it's all comes under the supplementary procedures. And agent information or device specifications, that's about the drug or the device, and what is the dose scheduling and modification. If they say like you have to give the drug 5 mg for 1 week and next 10 mg for next week, then the dosing schedule and also dosing modification is there in the treatment. And also the calendars, so at what time, at how long study has to be done. And many times study will also have different thing like switchover. The control can become the test after 15 days, and all those things are there. And this is what types of study designs using clinical research. So we have observational study. In the observational study, you will not interfere with anything. If the doctor is treating the patient, and you will just observe it, and you will not ask the doctor to give this treatment or that treatment. So without any involvement, we call it as the observational study. The next one is the interventional study. Interventional study here, uh, the you make the changes in the therapy. Okay, so you ask the doctors or anyone to include the drug that you use. Okay, so that is known as the interventional study. So, and the descriptive study. So descriptive study is more of like more same like an observational study, but you look for very specific things in the study. Okay, which is known as a descriptive study. An analytical study cross, and also this is called as analytical study. Uh, and also cross-sectional study and cohort study. Sorry, there is a slide, this one. So there is analytical study, cross-sectional study, and cohort study. These are the three different study. Analytical is more of, again, there is an any kind of the analysis involved, especially like you do the TDM, drug therapeutic monitoring. You take the patient's blood and you analyze for what is the quantity of the drug in the blood, and any kind of these analytical techniques are involved in the research. We call it as analytical study. The other one is the cross-sectional study. The cross-sectional study is at particular point of time. Okay, from particular point of time means from now onwards, what's happening at that particular point of time. We call it as cross-sectional study. At that particular, now you want to do like we are saying like how many people are affected with coronavirus today. For today, what is the status of the coronavirus? Then you do a research and find out the thing. So at this particular point of time, how many people are involved? So that's how it comes. So such kind of studies, we call it as cross-sectional studies. And here not included that two things. One is again prospective study and retrospective study. The prospective study is something where from this point of time to the future, that is prospective, that you do an act like an active study. And retrospective study is from this point of time to past. So already it has occurred, and go and check the medical records and or any documents and do a study. So if you want to say that from 1950 to 2020, so how many people have died because of this pandemic disease? So you want to do a study like that, then you're going to the backward time and checking the records. So that becomes a retrospective study. Or if you want to do from 2020, the April to next 5 years, how many, like coronavirus, how many diseases can come? If you want to do a study, then it becomes a prospect. That's the future. And also there are cohort study. Cohort study is nothing but in a huge population, in a specific area, a group of people, population. So that's what a correlation study. You want to do it anything like it in Bangalore, whole city of Bangalore, then becomes a cohort study. Or you want to do it in any specific area, then it becomes a cohort studies. And apart from this, the principles involved in study designs are mainly like study characteristics. What actually you are studying, that's a very important thing, which you say that that's how the designs is usually picked up. And also, what's the type of study design to be used? That's the another thing. And the way in which study will be conducted. Okay, so whether it conducted at single center, means only in one place, or multiple place. Like if you say like a new drug is in the has come to phase 3. Okay, so usually such kind of studies will be done in some 20 countries, 30 countries, and usually in each countries there will be like 3-4 different sites. Like in, if it is Delhi, it is happening, one is in Bangalore and one is in Mumbai and the other one is Kolkata. There are different centers may they have. So this is how mainly the study is conducted at multiple centers and different countries, allows to involve the study populations. Variability will be high because the genetic makeups and the food habits and a lot of things are involved when you the people when using the drugs get influenced. So all that can be studied. So that's what very importantly they usually go for multiple studies, global center studies. And also there is also a double blind. The blinding means the not be aware of what the study is to it will be done. Here we know that the company will be doing the study and CRO may take up on behalf of the company, and there will be a principal investigator and the patient. If the patient and the principal investigator will not be knowing whether it is a drug or a placebo, means placebo control means they may give sometimes dummy medication also. Placebo is nothing but dummy medication, inactive medication. It's nothing but it's like simple the powder. Okay, so but it will be looks like same like an the drug, the other drug what you use in the trials. So if it is known, if it is not known only to the patient, we call it a single blind. If it is not known to the patient and the principal investigator, then we call it as double blind. And all this data at the last of study will be analyzed by the statistician who do the analysis. So if the statistician does not know about which drug is given to which patient, so then we call it as triple blind. And also the placebo control you can use here is active drug, which is there in the market, or placebo, which is a dummy medication. So this double blind or the placebo control can be only used in the interventional studies. not in the observational, because observation studies you are not doing anything. And many times this double blind and placebo control, it is in RCT, that is randomized control trials. Okay, so here usually there will be a two set of groups. So one we call it as control, the another one we call it as test. The control is nothing, you give a dummy medication like a placebo, or you give any other drug which is there in the market. In the test is the new medication that is under the trial which you want to go to test. So that will be in the test group. So the people to assign whether is in the control or a test group, if it is not blinded, even patient will be knowing, patients will be knowing. But if it is double blind done, then patient and patients will not be knowing at all. So there will be a lot of process involved in this blinding and controlled things. And also the study can be randomized and non-randomized. Randomization, why it is required is to eliminate the bias. Means if it is say like you can see in the very few years back in the people, when you want to make children's two group, you can say that flip up the ants, they used to flip the ants. Okay, so to make it two teams, so whoever put the upper hand, so they will be taken into the teams like that. So same way, or flipping a coin, okay, head or tail, that's also a randomized. So people going into two groups, control and test, you should not select and send, it should be like a randomization. So only then the study becomes very effective. And also here the methodology, very important for any kind of the protocol thing. And also in the methodology, you can include the sampling collection of data and also statistical analysis. We use usually the p-value and a lot of statistical test based on the type of study. Statistical, this one we will be making a lot of changes. Also, there are some many merits and demerits of particular study, as I told. But depending upon the type of protocol prepared, the study designs can be implemented. And this is the next part, as I told, like criteria for evaluation. So what you're going to evaluate. So evaluations is mainly like safety evaluation, whether the drug will cause any adverse effects. So in that it can be like evaluation of liver function test, LFTs, or renal function test, RFTs, like etc. And also incidences of adverse effect. You can see that okay, this drug will causes nausea and vomiting, this drug will causes leukopenia, this drug will cause anemia, this drug will cause cystectomy, lupus erythematosus, this drug will cause there will be such a number of adverse effects to the drug. But there you have to see that incidence is uh, will be mentioned in the percentage. Okay, so in how many percentage of patients taking this can have these adverse effects. So if you say like, okay, if you say that adverse effect there is a 20%, okay, it's a huge number. So 20% of people taking a particular drug will cause the anemia, then it's a huge thing. There is this drug is causing 1% or 0.1% or 0.2%, then it is very rare and negligible also. So like this, it has to be evaluated. How frequent is the thing and how much severe it is the thing. And also the safety should also include information to include like expected list of expected adverse events also. Expected in sense, if it is already documented, then we call it as expected. Somewhere in the literature, if it is already known this drug will cause this event, then it is expected. But if it is not mentioned that this drug will cause this side effect, then we call it as unexpected. So this is the two things difference between the expected adverse events and unexpected adverse events. And the next part in the protocol is the study treatment. Okay, so you're using a particular drug for the treatment. So in this, what all should be included is you should include concurrent medication. So there is a definition to explain what is concurrent medication. So any drugs apart from the drug which you are using for the study, and the patient is using other drugs also. So that other drugs can we call it as concurrent medication. Same way, the disease which you are studying becomes the main disease. Apart from other diseases, if the patient is having, then we call it as comorbidities. Okay, so that's how usually we call it as for the drugs and the diseases apart from your interest. And formulation of test and control products also is can be has to be given clearly in the study treatment, what formulations and what is the dose and this one. Packaging and labeling, dose and dosage regimen, dispensing, administration, supply and store, how the drug should be stored, and what are the complications, okay, which is there, and also supply storage or the thing it will be included. Now we'll see the each individual one. So concurrent medication is same as told, like same medication throughout the inter-study period. Okay, so there was some internet interruptions. Okay, for is allowed except for treatments noted in the exclusion criteria, the standard therapy that we usually use. The concurrent medications list has to be maintained throughout the study and has to be given. And also the formulation of test and control products, as I told, like what is the formulations and what is the strength, okay, and control, and manufacturers specify the formulation in the protocol. Like what is the anti-active ingredient, if it is any injectables or this one we have to use mg per ml, or any other ingredient, what is the pH, and like this few of the things, not only specifically like this, it's just given, but issue. You can see the slides.
Yes, sir.
Okay.
Yes, sir.
So package and labeling also should be done to the drugs, and should you explain how labeling will maintain blinding. So if it is a blinding study, the labeling for placebo or other drugs should be same like for the active ingredients. And dosage regimen, it's also a very important one. You have to use like there should be information on dose, what dose the drug will be used, the route of administration, whether oral, parenteral, or anything, and dosing schedule. So 1 time, 2 hours daily, 3 times daily. And also timing between doses, optimal timing. Okay, so there should be at least 8 hours gap, 12 hours once, or every 4 hourly. This also should be mentioned. And also adjustment for weight. So many chemotherapeutic drugs and many antibiotics will be given on based on the weight, age, and also before meals or other after meals, and all this information should be there. Or any other pertinent information, and also the treatment periods, if it is there, it has to be mentioned in the protocol, the dosage and dosage. And even the protocol should explain the following things. The one is on dispensing, drug dispensing, the administration instructions. If there is any dilution, it has to be done. Dilution instructions, supply of drug at the site, and also storage and study drug accountability. There will be all the numbers, how much drugs. If it is lot of numbers, thousands of patients are involved in sometimes in the particular site. So all how much drug has come, batch numbers, all those things has to be maintained. Measures of treatment, even the complaints, how the patients, how much the patients are receiving the drugs, and all things will be maintained. And also the clinical assessment has to be done based on again concomitant medications based on that, and also demographics like uh, there is a date of birth, gender or race, and also medical history, physical examinations, vital signs, and other any clinical procedures. If it is there, it has to be documented as a clinical assessment in the clinical assessment. And this is a very important thing where the data help for the usually for analyzing the whole research results and outcome. The next one is the ADR. The safety is always very important. They give a lot of weightage for safety. So even if the drug is showing very little bit of good efficacy, but if it is safe, does not cause any major adverse effect, then we can accept that drug. But if it is drug is showing very good effect, but still its safety is also causing lot of risk, it causing lot of problems, like if it is causing like renal failure, if it is causing like myocardial infarction, arrhythmias, it's a very life threatening other adverse effects if it is causing. So even though drug is showing very efficacy, but because it shows a lot of life threatening ADRs, the drug will not approve. So that's what we always say, the drug should be safe first. The efficacy part is the next, which we usually see in the clinical studies. So adverse events we see like duration, start, stop dates and times, and severity and the grade. Okay, severity again mild, moderate, severe. There different grades are there, and also it could be life threatening. Life threatening is there is a high chances of the death in the patient, causing death in the patient. So throughout the study, all these things that has to be captured and reported and documented, very important. And also the adverse drug reactions will be recorded on the case form and do the causality. This is what we call it as the causality. It is the causality, which is the thing which is totally talks about like few things. We have WHO causalities, Narinjos, and different things. Like they classified as definitely, probably, possibly, and unrelated. If the drug is very well documented and you know that adverse drug reaction is happened because of drug only, then we can tell it as definitely. Okay, but you have little bit chances. There is a little bit chances of drug is causing, but not fully, not 100%. Okay, then we have probably, but there are very less. Okay, but still the drug may cause the this one, so it can be classified as possibly. And if the drug will never cause this kind of side effects, if there is a strong evidence, then we tell it as unrelated. So that's how it is usually classified, most of the drugs causing any adverse drug reactions. The next part is the clinical laboratory measurements. As I told, like lot of clinical tests will be there. This again, it makes it changes as per the type of the study. Okay, so it's not that all studies should involve same studies, but here we are given a little bit of the few studies, a lab investigation that will be done, like hematology, biochemistry, pregnancy test, urine analysis, pharmacokinetic, and any measurements, anything others than this. If it is there, they usually do it. But that again, it will be uh, mentioned by different by the different test. Okay, so this is the chart. Usually we have to include in the protocol, and it is something like visiting card, visiting chart. Okay, then it's also evaluation chart. If you say like for any immunizations, they give a chart and they say like, okay, on what day you have to come, and when you come, the different months, what is the vaccinations it has to be given, and all those things. Same way here, there will be a chart, and you can make it like you can see a visit 1, visit 2, visit 3, visit 4, and visit 5. Okay, so and it could be a day or week or month, any other thing. So in each visit, what all the activities should it will be done. So it is something like that. So first they take the informed consent. Informed consent is nothing but taking the willingness of the participants to involve, is giving that consent. Okay, you can see that in the many hospitals when you go, like for doing, before doing any procedures or anything, they will ask the dependent or the guardian to sign. Okay, so that's the consent, like is willing to do involve in these activities. And also taking medical history, complete physical examinations, and any abbreviated physical exam or height, weight, initials, that this all will be taken. But you can see in the day two, visit 2, 3, 4, 5, the informed consent is not required, because beginning only he has given that, okay, I'm involved in this study. So each visit no need to take. So this, if you see in this chart only, it will come to know what all the activities should be done on each visit. Okay, I can see that abbreviated physical exam is only in visit 2, 3, 4, 5 is not required. And when height, weight, vital signs, oximetry, spirometry is all visit is there. And pharmacokinetics you can see only in visit 2. And chemistry you can see that only in visit 1, 4 or 5. Like this, each visit it will looks like it is gives a very concise for the analysis, or even for the patient also it will be an thing. Okay, even for people who seeing others also, it gives a very quick understanding of how the whole study is going on. And same like this, the pregnancy test, it will be done in very few visits only. Hematology, yes, also few visits. And like this, dispensing of administration of study drug, counting of return study drug, you see that. So the study drug will be given from the visit 1 to visit 4. Visit 5 is just a follow. And you can see return study drug. So they will give for some weeks or months here. So once it dispensed here, then when the person comes to visit 2, he has to return what all dispensed here. Okay. So in the study, what they usually do is they will ask if there is a drug is comes in a strips bottle or anything. They will ask like do not throw off any um, if the tablet is taken out of the strip, even that empty strips also it has to be kept and returned. And whatever the tablets, many times the patient may miss here, those also you have to keep it. So that when come here, how they have dispensed here, the whole package, patient will consume only the medication and return the whole package like this. And even unused one also, they should return it. Then you will come to know that how the patient is taking the medication, compliance, and all those things you can come. Same way, if the drug they dispense again newly here, they will come and take here. They have to give it back at visit. Same like this, given here and this one, and lastly here they will not dispense because it's the last. And any initial subject diary also should be can be there. Review diary, patient they may ask, okay, you can check the blood pressure daily and write it in a chart, or check the blood glucose level. So they may give a diary and tell them to entry in that, or if they're having any vomiting or diarrhea or any kind of these symptoms, if you would time, date, they should enter in the diary. And concomitant medication review and any adverse experience in all the things it has to be. So that's how the chart usually it is used in any kind of medical research. And also, as I told, like discontinuation and replacement of subjects will be there. So it's not that the patient is signed the consent in the beginning of trial and has come to the trial, involved in the trial. The here subjects means patients, they can withdraw from the study from any point. Okay, even at they are at visit 3, they feel okay, I am not willing to continue.